So it's an honor for us to be here to talk about these issues that we have somehow overlooked in large-scale natural disorders and earthquake-related settings. So I will be talking about psychosocial support, starting from we will be talking about the emotions of the first responder teams to these disasters, because from both sides, it's not easy. For both parties, it was not easy to experience and not easy to overcome as well. So this is an older picture, if you would, of the earthquake-stricken zone. So you will be seeing some very old dates there. So like 1544, 1114. So these are all dates of the older large-scale earthquakes that happened in the area, and the numbers of the losses of life is almost the same as the entire population of the settled areas they're in. So this is a fault line where earthquakes happen very frequently, and where we are located at right now, or where we're looking at right now. The red marked areas are the major impact zones, and the other areas are other impact zones. So if you look at this from this perspective, we are talking about a very large impact area. We are talking about a 500-kilometer square area, and more than 13.5 million people were affected. And 10 provinces, 6 metropolitan cities, and 5 minor cities in Turkey were impacted. And due to this event happening as a storm of earthquakes, if you would, happening one after the other, has brought on different traumas as well. We had almost 47,000 casualties, 108,000 injured, and 3 million people needed to leave the area, were needed to be displaced. So this is the area of only the area wherein I work. This is the Kahramanmaraş, and the black marked area is where the fault line runs through. And the black areas have been completely destroyed. And not these points that you see, the dots that you see on the map, are not individual houses, but apartment blocks. So many people were impacted, as you can see. Of course, the first issue is to reach that area. That was the hardest part. There are many factors that inform this, one of which being the condition of the weather. So when we got on the road, at the wee hours of the morning, of course, we had snowfall in Istanbul, but we didn't know about the dire situation that was there. So this is what the roads looked like. There were people trying to reach their loved ones. There were ambulances, support teams, and since the roads were icy, and if an accident happened, you had to wait there. And beyond that, there were some information that we received concerning the closure of some viaducts and roads. And from Adana onwards, that was another great issue. And this is another striking picture that leads of a road that leads into Kahramanmaraş. So Kahramanmaraş had 7 tunnels that were named after famous writers, authors, literary authors of Turkish origin. So as you see, this is actually a two-way roads, and you'd see people just jumping on their cars without looking at their fuel tanks and so on. So we had to also help them out on the road because they were faced, I mean, there were children, babies infants faced with freezing conditions, weather conditions. It was below 30 degrees below zero. And when you went into the city, you would not understand what you were faced with. So I know Kahramanmaraş very well, but I couldn't really understand where I was at, if it was a city at all or not. So as you see, there were buildings that were collapsed, which were closing off the roads. And you see the smog in the air. So it's not caused due to any fires that happened in the city. It's just because of the cold weather. And since there was no internet service, you could not see anything where you were, concerning where you were. Navigation services did not work even. So you wouldn't understand where you're at within the city. So as we went along, I saw that white building, which used to be the municipal building. And I looked just across from it, and it was the rubble of the house that I grew in. That was the apartment block that was called the Boulevard apartment. So that was my childhood home, and it was demolished, as you see. Of course, you can react very differently as a healthcare professional. You get involved with the search and rescue efforts, and these are the areas, these are the zones where we grew up, where we lived. And everybody was just staying inside their cars due to cold weather. We were trying to find blankets. Then we were led to the hospital. This is the Sütçü University Hospital. And upwards there was the Yörük Hospital. And since my colleagues from the ER were there, I went to them. And as you can see, there are many cars around the hospital. And since there was electricity available in hospital, people just sheltered there. And then we went into the emergency service. Of course, I'm not going to be showing you what happened there, but I just want to show you some after pictures. Of course, it is quite telling, as you see, what kind of a trauma happened there. But what I saw there was something else as a healthcare professional. So if you if your associate healthcare personnel do not clear off these areas, clean out these areas, you cannot take in any more patients because they are going to keep coming in. And these stretchers that you see here, of course, as I said, the university hospital was spread out over a very large area and it was quite safe. So there were many people sheltering in the hospital as well. Well, it's a good thing that you're able to provide them with a shelter, but at the same time, you are unable to carry out your healthcare activities. So some of the corridors are darkened, but you see it is there are still people there. So after the first earthquake that happened the early morning hours, the healthcare professionals tried to do their best. But as we experienced the second earthquake after in the afternoon, everybody lost their faith and courage because people were thinking the world was coming to an end. I mean, this is coming from what we heard from them. They were saying the world is coming to an end, and due to that, the operations were left, the patients were left behind, and they had to just run out to save their own lives. But what you see here is this is a sterilized zone. The hospital is has seismic resilience. There are isolators, as you see. The metal parts that you see there on the walls are the isolators, and the hospital was completely safe. It had gas, electricity, water. Of course, this was the first time that healthcare professionals, or the second time that healthcare professionals were experiencing such a thing. So this is the hospital of the medical school. So you see upstairs there is nobody, but all the doctors were downstairs in the ER, and they were working relentlessly. Then after our activities at the hospital ended, we went to the Disaster Coordination Center to help in healthcare efforts and the search and rescue efforts of the Turkish Red Crescent. I worked at the Disaster Coordination Center for almost 3 months there, together with our MPs, our minister, with all the stakeholders at the DCC, our solution partners. So this is the soup house that was established by TRC. So it was established within the 15 Temmuz Park. Of course, there are many stories that I can tell about this. I mean, yeah, we were the ones who enabled its operations by, getting the enabling the electricity and water connections and so on. So as you see here, the disaster was quite a large, had quite a large scale, one of the most widespread disasters of the recent history, if you would. And only within the first few days, there were more than 21,000 aftershocks. Well, you get used to them somehow afterwards, but of course, you cannot help but feel impacted, thinking that whether buildings are going to be collapse, or whether you are going to lose your own life as well. So this is an image from Kapıçam district. Ömer Hoca will be explaining this as well. So this is where the casualties were identified, and there were also activities carried out to, receive the condolences afterwards. There were many lives lost there. So you see the rubble clearance activities there. So only within Maraş, there were more than 7,000 collapsed buildings. So with such a number, and considering that most of these are apartment buildings with people still inside, of course, all search and rescue teams were unable to reach these areas, and they were unable to provide first line response there. No country in the world has such a capacity, if we should speak frankly. And here, concerning nutrition, food, hot food was unable to be provided. I mean, yeah, in the beginning we were able to provide it, but right now it's decreasing. The need for that is decreasing. Right now in the earthquake-stricken zone, people are able to buy their own foodstuffs and cook for themselves. But there are also the vulnerable groups which are still in need, to whom we are still providing hot food. And this is a very good slide that I like to explain over very much, because there is something that we have learned as a state and as an institution, very important, one important thing. So distinguished participants, let me say, what we call this most of the dishes that were handed out belong to non-governmental organizations. So from the outstart, our non-governmental organizations were active on the field. I mean, I cannot just name a single organization or a single city, because everybody from all over Turkey was there. Of course, within the first 24 and 48 hours between these 2 days, we were, flapping about in a sense. Nobody was ready for such a disaster. But between 6th and the 9th of February, we saw many people helping each other. Logistics systems were established very well, and the support teams were able to reach the field and carry out their assistance activities. And as you see, we handed out the tents for the victims. So we reached a number of around 130,000 tents, which belonged to AFAD and Turkish Red Crescent as well. And there were also some tents that were provided by international organizations. But tents are garbage, if you would. So it's just something that you can provide as a temporary shelter. So if you are unable to relocate these people to the better established areas, they turn into garbage. And there are many organizational issues that are faced here. People can just tear it up and bring it to their own houses. There are fire-related safety issues. So we were just trying to keep them in a controlled manner, in groups, to keep everything under control. In the future, there will be different approaches in organization likewise. And at our first day, the first food distribution happened at the refugee camps. And it's quite important because they were quite, let's say, resilient and prepared for such disasters. And they were communicating very well, coordinating very well, because our own citizens were quite shocked. And these traumas renders these people much experience. So this really creates this resilience in cases of emergency. They are able to provide the first response in a much easier manner. What you see here is the sanitation areas within the tent camps. And we were also joined by Professor Hasan Turan from the Coordination Center, especially during the disaster relief efforts. So we saw the responders having a need for therapy or just to talk. So while we were there, we were talking with them, starting from the governor to ranging from response teams, people working on the fields, the police officers, and so on. So it's not only about the victims of the earthquakes directly. We had some very valuable interactions with all stakeholders there. And there were, chocolate bars or small cakes being shared with children, for instance. And there was just one child that told to me, for instance, I'm glad that the earthquake happened. My mother is not saying anything about what I'm eating, and everybody's giving us treats and so on. So, of course, we knew the fact of the matter. It's not really good, and this needed to be controlled. And indeed, that was what happened. And the dependency of the children on their parents were underlined once again. But we can really say that the psychosocial support teams have played a great role there. And when it comes to communication, electricity, potable water, and transformation, yeah, we had the greatest issue with natural gas connections. I personally learned that that would be the most important thing to do. And also, without a governor, you cannot do anything at coordination centers. This is another thing that I have learned as a valuable experience. And what we did during this disaster relief effort is, or as an institution, what we did was the medical evacuation. So during the war in Ukraine, I also saw and had some information about the medical evacuation systems that they had there. So the medical evacuation that we carried out was also striking for them, to them as well, because we were effectively able to transport patients from the field. Of course, there were identification-related issues. This is going to happen, of course, but everybody found their relatives, and everybody was identified in the end. Our greatest issue was later on turned out to be social media. For instance, one of our colleagues was working at Mersin Children's Hospital, and while he or she was working there, we were sent a post from Instagram. So it was just one lady shooting a video in Mersin Children's Hospital. You are saying that the hospital is about to be torn down, and just people are rushing in there and so on. And we called them and asked them whether if there was something wrong going on, and they said, "Well, we are used to it. This is our normal." They said. And secondly, potable water is another issue. And people were thinking they would not be able to find potable water. And there were actually 7 water springs there. And from the second day onwards, the water supply was safe. So only in the first day there was some issues. So then bottled water was started to be stocked by people, and you couldn't find any bottled water in the area, and everybody was stocking up on bottled water, as I've said. So this perception management was quite important, and as we carried it out. And then mobile health clinics also at the periphery reached out to people. We had an advantage in Maraş because the basic hospitals were standing still. So people were able to reach and get access to healthcare services there. So we received also help from the EMT, UK Med. There were other teams from Israel, Azerbaijan, and so on, of course. And then in one of our hospitals, there were, for instance, some doctors that left due to being afraid of further risks. And then the team from Israel said that the hospital is all right, we can work there. And then the others came in and worked in as well. I mean, this is something that we see all over the world when a disaster happens. So you have to encourage your teams as well. So they were also taking in at least 300 people together with UMKE, our national medical rescue teams. And I would like to talk about one important thing that became clear with this recent earthquake. So international support and aid really increased because the international community has a better capacity and better reach. And this is something that we have been discussing within WHO as well. whether the assistance and aid provided in disasters is effective or not. Of course, our main purpose as healthcare professionals is to save as many lives as we can, and we have to have teams that are acting in a timely manner. So what matters is that if you are within the field within the first 24 hours, you can do things. Of course, after that, you can do many more things, but to deal with the disaster, there's not much that can be done. So, first, you receive trauma emergency patients, and secondly, there are the trauma complication group, and thirdly, there are indirect cost infectious diseases and accumulated elective care needs. So, these are in order what you need to deal with. So the fourth group also includes psychosocial support, childcare, and others. So this was the algorithm that we came up with after the disaster. And so what happens after the trauma is done away with? I just wanted to provide some examples. For instance, in the earthquake in Bam, Iran, there were, for instance, 34 national USAR teams consisting of more than 1,300 people, but they were unable to save anybody. And the USAR teams in Kashmir, Pakistan earthquake were able to only find 24 survivors. The same also could be said for the earthquake in 2009 in Indonesia. So there were 1,117 people that were lost during that. And within the first 48 hours, even though they brought in rescue dogs, they were unable to rescue anybody. So you need to have these response teams, but none of the USR teams have the capacity to do that, save people within the first 24 hours. The same also happened in Port-au-Prince. They were only able to save 34 people, and in Christchurch, New Zealand, there were around 600 USAR teams, and they were only able to save 1 to 3 people. And in Lamjung, Nepal, there were more than almost 9,000 people who lost their lives, and only 16 survivors were rescued by 74 USAR teams. So looking at these numbers, you can see the summary in the table here. So the USAR teams, after the first 24 hours, if they reach the area after the first 24 hours, it means that you won't be able to save the majority of the victims there. But what we saw in Marash is that there were people who knew each other, who were more close to the service, and they picked each other up or dragged each other out of the rubble. For instance, if you were able to get out by yourself, those on the surface were just calling out for the others inside and trying to rescue them. So this is what is called a lightweight search and rescue. So you do not tear down any rubble or, I mean, this is something that we have learned about as well. This is something that the society should know about, become made aware of, and worked on together about. So this is something that coming generations should be informed about, and we are going to face large-scale earthquakes, and this is something that should be taken into account. Because we are talking about more than 7,000 torn down buildings, and there are not 7,000 USAR teams throughout the world in total. And disasters have impacts on our vulnerability capacities. And what you see capacity, and this is the capacity building and training and practice scheme. So if you want to create a good response against disasters, you should do just that even before the disaster happens. If you can establish the system very well, then if an earthquake or any other disaster happens, then you can have a good response and then build their own. And psychosocial support is indeed part of that. Thank you so much for listening to me.